Hi, I'm Dr. Dennis Harding, and I'm an Atlas specialist. I'm a chiropractor, and my specialty is the Atlas bone. When the Atlas is crooked up on top and out of place, it affects down into the neck, it'll affect down into the arm, all the way down the mid-back, even to the hip, and down into the leg. It also changes distorted brain images because it shuts off the brain stem right up on top. The important part of what I do that's a little different is the blood supply to the brain. Where the blood supply comes up to the brain and affects, literally shuts down 2/5 of the blood supply to the brain. What we do is very specific to get the blood supply restored to the brain. We're very unique in that way. This is a 12.5 pound bowling ball, and the average skull is 9 to 15 pounds. And so this is a fairly average skull. And so imagine that bowling ball sitting right in that tiny little cup of that Atlas bone. So the Atlas itself weighs about 2 ounces, and the bowling ball that sits on top of it is between 9 and 15 pounds. So where this bone sits right at the base of the skull is very susceptible to injuries. So if you were in a car accident where you had your neck whipped or whatever, or rear-ended where you had the weight of that bowling ball pulls that Atlas crooked, it will actually change the way that the bone is aligned in there. So my specialty is correcting the alignment of that vertebra.
Before I came here, I got headaches a lot, like ever since I was a little girl, and even sometimes I would get them so bad that I'd get sick to my stomach.
I had been treating for over 3 years and had physical therapy for over a year, and really didn't make a whole lot of progress till I came here.
We see patients with that bone displaced with various different injuries. Everything from a difficult birth trauma to young boys playing football. We're seeing a lot more cheerleading accidents where they fall, or they're not being caught correctly, all the way from motorcycle accidents, obviously car accidents where it gets, the top of the skull gets whipped, and it changes that relationship. A lot of times the symptoms won't come for several weeks, even months. So what we see a lot of times is after somebody's sustained an injury, they may be sore a little bit, but then the symptoms don't go away. The headaches stay in there. They become more frequent, more severe. The neck pain comes in here. The blood supply to the brain, partial blood supply to the brain, comes up through each one of the holes in the neck bones up, and it does 4 90-degree bends, hooks around a little curve right there, and then goes up into the brain. That part of the brain, right up in the very top, that bone, when it's crooked, shuts off blood to the brain, as we talked about, and is the major cause of dizziness. About 96% of all dizziness, nausea, lightheadedness, even energy loss, more pain, eye movement, emotional stuff. Brain fog, one of our big complaints with patients is brain fog when this bone is crooked for a long time. It affects neurological control of the heart, the lungs. There's one new research article about high blood pressure being affected by this bone being crooked. So what we do is we do a 3-dimensional picture of the Atlas. We take a picture from the side, the top, and the front, and we actually can line up accurate within 1/2 degree any resistance to stop that bone from moving it. So we don't need a real hard force to move it.